Contact tracing is an activity that's commonly done when communicable diseases or diseases that are passed from one person to another become problematic in a community. When they are happening in rates that are beyond what one would expect, which are typically called epidemic rates. And as we all know, for SARS-CoV-2, the virus that causes COVID-19, it is happening at a pandemic rate. So contact tracing is where we identify the people who have been infected and the close contacts of those individuals who have been infected to better interrupt transmission. So by interrupting transmission, we minimize the chances of the infection being passed from one person to another. The instructions that one can anticipate when they get a phone call saying that they are a close contact of someone who has SARS-CoV-2 and COVID-19 is to prepare for testing, particularly if they become symptomatic, to ensure that they go into quarantine. And quarantine means that you now limit the amount of exposure that you have within the general community. You're going to be staying away from other individuals within your home or a safe space. And then you'll be also instructed to answer the phone when we call back to make sure that we are following up with you to ensure that there aren't any barriers to your quarantine. So this would be a situation where you would not be going to work, you would not be going out and about into the community. On the campus, there are rules that we have for social distancing, and those rules require that individuals be 6 feet apart. In the event you end up being a close contact, then you'd be notified within 24 hours of the person who has the infection getting their test result. And if you are not a close contact, you will also hear that you didn't receive notification, and all of those who needed to be notified were notified, so that in the event you were having worries about it, those worries could be put to rest.